Dudziro Nhengu, and I'm presenting from Zimbabwe on challenges of integrating virtual learning practice in Zimbabwe secondary schools during COVID-19. I have started sharing my screen. Can you see my screen now?
Yes, we can.
Okay, thank you very much. So my presentation will be in different parts. The first part is the introduction. The second one is the background, the methodology, the findings, the discussions, and the conclusions. So the study investigated the risks, the challenges faced by the Zimbabwean education sector in integrating effective virtual learning practice into the secondary school system during the COVID-19 lockdown. For the study, I focused on a case of the Harare Metropolitan province, which is one out of the 10 provinces of Zimbabwe. And the study was guided by 3 research questions, which are: what was the role of education technologies in influencing the continuity of secondary school education after the COVID-19 lockdown? What challenges did teachers and learners and policymakers encounter in the changeover from face-to-face to virtual learning? Which ICT tools did secondary level learners utilize most to access virtual learning? And for the background, I am looking at the summarized background of ICTs and virtual learning, first in Africa and then in Zimbabwe. So in Africa, there is no agreement on when virtual learning became a practice in the education sector. Whereas in Southern Africa, where Zimbabwe is located, the use of ICTs can be traced back to the 1960s. And virtual learning actually started between 1990 and 1999. And 2 scholars, Donna and Gitau, argued as far back as 2009 that the future of Africa would be technocentric and virtual. And 10 years later, in 2019, 4 other scholars likewise argued that Africa is the highest technology usage rate, especially mobile phone adoption rates in the world, further projecting this trend to remain so till at least 2025. This postulation is, however, contestable given the fact that Africa is still lagging behind in terms of economic management and technological advancement. So the claim remains contestable. We have to problematize which other regions or continents they were comparing Africa to when they made that postulation. In Zimbabwe, before the outbreak of COVID-19, many private schools and other elite government schools were already accustomed to the usage of ICTs as tools of knowledge management and learning. However, very few schools in other regions like rural areas and regions in the peripheries were also using ICTs and virtual learning. So there was already a gap, in urban-rural divide regarding usage of technology before the outbreak of COVID-19. So this being said, success of integrating online education technologies in education in Zimbabwe was obviously anchored on social determinants of education, such as economic background and also geographical positioning of the learners and the teaching during the pandemic. There is evidence, which is however varied, which proves that between 20,000 and 840 children dropped out of school during the COVID-19 lockdown. However, again, this finding is contestable because the reasons for these school dropouts also included issues like child marriages, early pregnancies, disease. So COVID-19 was not the only reason why there was a drop down rate that was high for secondary, for school learners. Furthermore, the notion of school dropouts itself would have to be clearly defined, given the reality that at one time, all institutions of learning had to shut down in Zimbabwe for quite a significant period, while policymakers and education practitioners tried to find solution to the COVID-19 pandemic. The next slide is on theoretical framework. So two interrelated theories guide this study, and these are geographies of insecurity and geographies of economic inequality. The study also problematizes the linkages between the notion of increased usage of ICTs and then versus the notion of success of virtual learning practice during COVID-19. Geographies of insecurity in this paper emphasizes the fact that COVID-19 was inherently geographical in its impact on society. Global institutional power structures and mechanisms are organized in a manner that naturally gives development nations power over developing ones, in turn breeding systems that saliently deploy discriminatory and skewed policies and services in a top-down manner. So after the outbreak of COVID in China, the pandemic spread from neighborhood to neighborhood, firstly in countries with intense proximity and relations with China, and later to other countries on the peripheries, taking advantage of the forces of globalization to spread to all countries. Embedded in the notion of geographies of insecurity and the manner in which COVID-19 was spreading is the theory of spatial autocorrelation, which is espoused by Amadod and others in their study of 2020, which clarifies the patterns in the spread of COVID-19. So the theory of spatial autocorrelation contains that close geographical units are more affected than distant geographical units at the outbreak of a pandemic. And as such, these spatial differences in time frames within which COVID-19 was spreading to various countries determined first its impact on citizens and also its impact on development processes and response strategies. Secondly, these spatial differences also determined the response rate of various nations to the effects of the pandemic, the decisions for lockdown periods, as well as the responses in couching suitable stopgap measures for various services, and in this case for the virtual learning service. As such, while the first COVID-19 lockdown was enforced in January in China, in Zimbabwe, the first lockdown was enforced 3 or 4 months later, which is in April or May. And also, China being technologically advanced muted the idea of transitioning from physical to virtual learning as early as January 2020, whereas in Zimbabwe, the first lockdown was operationalized in April or May 2021, but it took the country 6 months later to figure out modalities for transitioning to virtual learning. And finally, when virtual learning took off, it was possible only for a few learners in some urban areas, while the majority of learners in both urban and rural areas could not afford it. And this reality leads this argument to the notion of geographies of economic inequality, which is espoused by Van Ham, Manley, and Tamaru in their study of 2022. So the notion of geographies of economic inequality predicts the spatial categorization of both learners and teachers by income, both vertically and horizontally, as well as the associated modeling of opportunities and affordability. Thus, the usage of ICTs organized people into different levels of vulnerability, depending on their geographic positioning, as well as their economic and social standing. Such geographies of inequality and economic disparity thus range on a spectrum. Differences in access between individuals and among groups in urban areas where, although there was internet access, some students and learners could not afford the expenses associated with acquiring ICT gadgets and internet. And also differences in access and affordability among urban and rural residents, especially in those remote rural areas where access to internet has been for long devoid, also referred to in this paper as the social determinants of virtual learning success. I also look at the notion of increased usage of ICTs owing to COVID-19. COVID-19 was indeed a catalyst to development through increased usage of ICTs and knowledge, or because of the reality on the ground. The term increased usage can also refer to aspects of inclusion and participation across gender and class divides. Many people, unlike before, started using virtual learning and ICTs. However, this increased usage does not automatically entail that there was success in virtual learning, because these users faced other problems, such as, did they know how to use the ICTs? Did they have enough internet access? Did they have resources to maintain usage? And was the usage of ICTs for virtual learning applied uniformly across the geographic divides in the country? So those are all questions that I look at in the discussions as part of the theoretical framing. And moving on to the methodology section, I used a triangulation of a survey with 65 participants, which were sampled from a population of curricular specialists, teachers, and learners, as well as key informant interviews with 35 key informants, also sampled from a population of curricular specialists, teachers, and learners. The response rate for the sampled study participants was 35 for the online survey, 35 out of 65, which was 54%, and 24 out of 35 for the key informant interviews, which was 69%. I also used a review of available literature to collect data to aid the study. So in terms of gathering the literature online, I used the keywords to search for relevant readings, and 53 published online journals, reports, and articles were identified from the database search. A careful scanning of the identified 53 papers was also done to eliminate all papers that were not directly related to the topic under view. And finally, I remained with a total of 39 articles that I reviewed. So quantitative data were analyzed and presented through tables and charts, while qualitative data was presented under various relevant themes. And for the findings section, the first finding, according to the pie chart there, was that two types of education technologies were utilized for virtual learning in Zimbabwe during the COVID-19 lockdown. And these two types of technologies were computers and mobile phones. 100% of the respondents indicated that both these educational technologies played a major role to facilitate the transition from physical learning to virtual learning. The specific roles of computers included accessing learning platforms such as Google Classroom, Zoom, Moodle, and WhatsApp groups, typing of notes and assignments, as well as storage of notes and related materials. Computers also facilitated the reading of textbooks, as well as transmitting information and documents through email, Bluetooth, or send it. The respondents indicated that mobile phones had the same role as that of computers, highlighting, however, that it was difficult and time-consuming to read big textbooks and bulky notes from the small surface of mobile phones. While those respondents who did not possess computers still used mobile phones for all learning tasks, all respondents generally agreed on the ideal role of mobile phones is that of communicating with learners and schoolmates, as well as transmitting documents and related information to schoolmates and teachers. All respondents also agreed that where there is no direct internet service installed, it is more affordable to use a mobile phone than a computer to send documents from a distance, as Bluetooth and share it can only send to devices in proximity. Secondly, the study sought to establish which ICT tools were most utilized by secondary school learners to access virtual learning platforms during COVID-19. While all the respondents, so I will show you the next pie chart for this result. So while all the respondents accessed learning materials either through computers or through mobile phones, the mobile phones, which are less expensive than computers, were established to be the primary devices used. Only 30% of the students and teachers who participated in the study attested to owning a family computer or a personal one and a personal mobile phone, while 100% of the responding students and teachers attested that they owned either a family mobile phone or a personal one, because mobile phones were found to be more affordable than computers. Furthermore, the majority of the students, which were 85%, used mobile data packages to connect to the internet, and only a few, 15%, indicated that they had a home Wi-Fi connection and thus had a choice to use either the installed Wi-Fi service or the mobile data, which again makes mobile phones the more utilized than the computer. These findings concurred with foregoing research findings by a number of scholars, such as Donna and Gitau, who predicted that the future of Africa is anchored on usage of mobile phones. Furthermore, establishments were that there is evidence to prove that mobile phone adoption rates in Africa are the highest than in the world, which, however, I said can remain contestable. Mobile phone adoption rates were further projected to remain highest in Africa till at least 2025. according to a study by Maramba of 2019. The final objective was to establish the challenges that teachers and learners encountered while transitioning to virtual learning during COVID-19 lockdown. The key findings under this objective was that virtual learning is very important for secondary school children in Zimbabwe as a complementary method of learning in both times of crisis and out of crisis. The key argument was that virtual learning for secondary school learners was also faced, this key finding was further expounded by the fact that virtual learning was faced with a lot of challenges at the time of inception, and that these challenges still exist in their many forms. And as such, virtual learning cannot entirely replace physical learning for secondary school learners in Zimbabwe, but can only complement. All the study participants concurred that both teachers and learners experience challenges in gaining access to the virtual learning and research platforms, as well as in accessing their emails for communication purposes. At a general level in Zimbabwe, there is a challenge of a network coverage issues, challenges of receptibility. There is always low network, and it's difficult for people to easily access internet. Furthermore, internet service providers are often challenged by the network service, which is congested. And there are a few indigenous internet service provision companies in Zimbabwe, maybe 2 or 3, while the rest that relied on provision of hardware from outside the country could not cope with the import costs in a country that legally utilizes local currency and has to use foreign currency to import the required hardware to ensure that internet provision is stable. The reality with internet access also in Africa is that mobile network operators manage fixed infrastructures that house, for example, a radio access network with base station, a broadcast network providing the communications spine, and a core network with alternating facilities and database servers handling user information. And this was established by Van Stam in 2021. As such, what citizens are able to access and the speed with which they access the internet will all depend on the viability of a given mobile network service provider. Where there is limited competition, such as in Zimbabwe, effectiveness of internet access is highly affected, and the usage rate is also affected. It is only a few rich people from the rural areas, for example, who could access mobile phones and internet services, while the rest, the majority of the people from the rural areas could hardly access it. And this creates a rural-urban gap because most of the people in the urban centers can access internet services. As such, comparing the state of secondary school learners from Zimbabwe with that of secondary school learners from countries like China, which I have used from the beginning, will further reveal how virtual learning was indeed gendered in all spaces, from the micro to the macro levels, further confirming the notions of geographies of insecurity and the geographies of economic inequality already discussed. Accessibility, as established by Alsheri, Rata, and Smith in 2019, is a very important variable that influences learners, parents, and teachers' perceptions of virtual learning, while also affecting the delivery rate of learning in any context. The other finding was that there was lack of regulated policy on usage of technology in Zimbabwe. Zimbabwe also embraced the transition from physical to virtual learning in all schools that could manage the dynamic And these were mostly private schools and a few elite state-run institutions. The lack of preparedness in terms of resources and time frames to transition to virtual learning meant that the process was done haphazardly without any policies, rules, and regulations in place to ensure uniformity in service provision. And this was a violation of learners' rights because some of them were excluded. And as such, virtual learning benefited only a few, and its effectiveness, impact, and potential to replace physical learning during COVID-19 remains questionable. Again, most citizens do not have internet sources installed in their homes as already identified. The other finding was that of ignorance of technological know-how and inadequate qualified technology teachers. Before the advent of COVID-19 in Zimbabwe, not all schools made the study of ICTs compulsory. Some learners and teachers did not have access to computers except to mobile phones only, while most in rural areas did not have access to both. As such, the period of transitioning to virtual learning became for some the time to seriously learn and get used to using ICTs. This delayed the uptake of the virtual learning exercise as well as affected the uniformity of the exercise, as some learners and teachers would always lag behind. The other finding was lack of adequate parental involvement in virtual learning processes. Almost all teachers and learners who took part in the study highlighted that many parents could not assist their children with homework. Secondly, virtual learning did not facilitate any kind of motivation on the part of learners and enough feedback on the part of teachers. Higher secondary school learners argued that although they were mature enough to manage their learning on their own, they used to benefit from the feedback that parents got for their teachers on parent day events. For example, when parents came for one-on-one encounters with their teachers. These feedback sessions helped them because teachers were able to make the parents understand some of their needs, especially for material and moral support. The disclaimer for these findings highlighted from the qualitative analysis is that some of the students, teachers, and policymakers in Harare Metropolitan, which was the study site, spoke on behalf of rural students who were not part of the study. However, their claims were validated by findings from the desk review, so they remain valid for the study. I move on now to the discussions slide. So overall, the results from this study revealed that the operationalization of virtual learning in Zimbabwean secondary schools during COVID-19, in the absence of physical learning, caused a number of challenges for both learners and students in Zimbabwe. This confirms findings by foregoing researchers who also established that due to its multiple complications, virtual learning has only succeeded in presenting promises that it cannot accomplish in 2013. While these scholars were referring to a period prior to COVID-19, the finding is indeed applicable now, further showing that the complications associated with virtual learning are realistic because they were projected as complications that face people during pandemics, and the postulation proved realistic during COVID-19. The benefits of virtual learning cannot be overemphasized, yet the rendition for these benefits to be realized is a prior fulfillment of other requirements that make practice work for all, what I referred to as the social determinants of successful virtual learning practice. While virtual learning is indeed good in terms of transcending the time and cost hurdles that physical education brings, it can only work effectively and inclusively as a complement to physical learning, but never as an alternative to it in this context of Zimbabwe to avoid the exclusion of the majority of learners and teachers, as UPAL established in 2018. Jenga and Fowry also opined in 2018 that learner attrition rate increases in virtual learning as opposed to face-to-face learning. Virtual learning can only work effectively for all after a lot of considerations, for such issues as policy reforms, infrastructural development, and training of trainers, as well as provision of resources as part of the preparatory measures. And I move on to the conclusions section. I concluded that the transition from face-to-face learning to virtual learning, which happened in some parts of the country of Zimbabwe during the lockdown, was a highly critical move which remains important for secondary school education in Zimbabwe and beyond. However, given the resource and other identified complexities in the country, virtual learning is not highly effective as the better, was not as highly effective as the better part of the population of students, teachers, and parents were excluded from enjoying its benefits. In Zimbabwe and similar countries in the global south, virtual learning can only be effective as a complementary method of learning to physical learning, not as an alternative. There are a number of considerations. These are now like recommendations that policymakers should put into action to roll out effective virtual learning practice that can remain effective both in crisis and out of crisis times. And these include investing more in state-of-the-art ICTs in both rural and urban areas in order to bridge the inequality gap of rural and urban citizens, ensuring that all schools and homes are electrified or have access to alternative sources of energy that enable them to use ICTs and internet service, providing viable internet services to all citizens at affordable and subsidized rates, rolling out training for ICT usage to all able citizens, especially in schools, and putting in place binding policies that make internet service providers commit to efficient service delivery, as well as policies and regulations on how schools should provide online teaching services that are uniform to all learners. Thank you very much. This brings us to the end of my presentation.